Hope everyone is doing well. If you would go ahead and place your name and campus in the chat. All right, so we'll go ahead and call it official start time. As always, these sessions are recorded and they can be viewed by the attendance administrators. Make sure you place your campus and your name in the chat. Check your screen name, ensure that it matches how it appears on the roster. All right, welcome to week 10. And get our course pulled up here. We'll hear from you all, and then we will go over Hesi information content rather. And that is the plan. Next week, hopefully this is week 10. Hopefully you've been receiving information from your campuses. If you have not, reach out to your campus dean as those Hesis are campus specific. So just make sure that you're finding out information about what you need for your Hesi on your campus for next week. Generally, all Hesis are given in week 11. And then sometimes I told you all, it may or may not be at the time that your classes were originally signed. After you take, we don't meet for Hesi. So, for example, whatever time your Hesi is, that counts as your attendance for week 11 for your classes. So you don't log in, um, for our regular scheduled class. But then we do come back on week 12. We meet briefly. We usually go over trying to share my screen here, the results, comparing them to nationals, and we kind of look like back at the last couple of years too. So again, we're in week 10. We're going to hear from you, your leadership group projects. We'll do that. And then we'll review over Hesi content, which is all the concepts that we've been talking about this term. We do have some little case studies. So you can kind of, start testing the water and then writing down and creating your list as what concepts you need to go back and study, first, second, and so forth. So for the most part, you will have to be able to apply what you know. There may be a few questions about, question and definition, but for the most part, you have to be able to apply what you know and make sure that you're looking at those question identifiers if they're wanting you to select priority, if they're wanting you to answer in the negative or the positive, all that. And then, so also you should have received now this comes to your Outlook mail, not your Canvas mail. You should have received, and it comes from Education Affiliates, and you get this every term. It's a survey that they want you to complete. So go ahead and start working on that because that's an additional thing that you can have already completed prior to coming to week 12. Now, there are some instances where you might have to put this does not apply because it asks an array of questions. So in the event that there's a question that does not apply, just make note of that. All righty, so we'll give you a few minutes to adjust yourselves. Do we need to put you out in a small breakout room before we officially hear from you all? Or are we ready to go? Group, pro group project presentations.
Excuse me, I have a question.
Mhm.
Is this survey mandatory?
I don't think it's mandatory. It's just strongly encouraged. I don't
Gotcha.
think it is. Yeah. It's your opportunity to leave, feedback. Okay, so I'm hearing that we're ready then to present. So let me just get the group schedule pulled up and we'll just go down the list. Alrighty, so we'll hear about navigating ethics first. And you all just let me know if I think you all have shared capability. So whoever wants to share it, and then just go from you all come in your own form in presenting. So navigating ethics, and then leadership and delegation, get ready, and then PNs and shared governance. You all will be next. So in order to share, you just go to the on my screen is a square with a arrow in it that's pointed upward. You just click it and you're able to share.
I'm pulling it up right now. Give me a
Oh,
second.
sure. Do you see that square with the arrow in it? Because I think you all do are able to share.
Yes.
Okay. Okay. So we're good on that.
Can y'all see the screen?
Yes.
All right. All right. So we will be presenting navigating ethics and boundaries in in practical nursing. Um, this is just talking about like how becoming a practical nurse includes understanding ethical dilemmas, legal responsibilities, and professional boundaries. And the importance of knowing these things as a practical nurse is to use them while facing like ethical challenges in the field that requires like sound judgment and adherence to professional standards. Now, an ethical dilemma. This is a situation where a person must choose between two or more actions that involve conflict in morals, moral values, or professional responsibilities responsibilities. In healthcare, ethical dilemmas happen where there's no clear right answer. Each choice may have both positive or negative consequences. Let me see. This one is for Amanda. Can you tell me like examples of common ethical dilemmas?
All right, so that would be balancing patient confidentiality with safety, patient privacy versus risk of harm. And confidentiality is important, but not absolute because, there are basically factors and variables, things that apply that makes it not absolute. Like, law, if it has anything to do with a criminal case, suicide, or any form of attempt like that. And also, well, applies when harm to self and others is possible. Balance autonomy and non malefiance. Key question. Does this put someone at risk? Go down. All right. So the example scenario would be the patient expresses harmful intent, just like I just said. This is a serious ethical and legal concern. Also, safety takes priority over confidentiality. Do not promise to keep it a secret because that is illegal and that can count against you and your license as well. Report to the provider or supervisor, which would be immediately, and document statements and actions clearly, meaning make sure that you have dates, times, basically make sure that you have yourself covered and you also have the event covered as well. Everything that took place at what time, what was said, what was done, to counteract it. But yeah.
My slides were what's the importance of confidentiality? Confidentiality is important for patients because it makes the patients feel safe, respected, and able to trust their healthcare providers, which is privacy is protected still. And it makes it a little bit more comfortable for them to open up to you because you feel like they can trust you. Next. Prime examples of when confidentiality can be broken. If it's like threatening or harming any, I guess you would say the patient or others, suspected child, elder, and domestic abuse, reportable like STDs, STIs, anything that it can cause harm to body, basically. Court orders and legal investigation, medical emergencies when immediate care is needed, suspected neglect. I can't see. Gotta move my picture. And also like billing. And I think that's Deanna this next. There we go.
Deanna, you here?
I
Don't
don't
look
think
like
she
it.
is, but that's her flat. She did it though.
Right.
LPNs follow state nursing laws, facility policies, and scope of practice guidelines. All right, so they also protect patients' rights by obtaining proper consent and maintaining confidentiality. Documents care accurately and promptly to meet legal and professional standards, meaning that you have to make sure you have documentation because, say, for instance, you have to go to the courts for any
Mhm.
reason at all, like patient safety, patient death, or patient abuse, neglect. You'd have to make sure you have your documentations down to the T to present them, and also avoids practicing beyond training or delegated responsibilities, maintains professional nurse-patient relationship to prevent boundary violation, meaning do not get too close to your patient, not in the sense of not providing trust or make them trust you or, but also don't try to cross certain boundaries or let them feel like it's okay to talk to you a certain type of way. You got to keep it professional, assertive, but also friendly. Reports unsafe, unethical, or illegal practices to help ensure patient safety, meaning make sure that you do your sterile techniques when you're doing wound care. Make sure that you have the rails up if you're going to turn a patient. Make sure that the bed is locked when you're about to get a patient up to transfer for any reason at all.
Right. Then the role of documentation as an LPN, your role of documentation maintains accurate, patient records to support safe, ethical, and quality care. It protects the patient's confidentiality and ensures compliance with healthcare laws and policies, promoting professional boundaries, as Amanda said, and, provides legal protection and accountability for all nursing actions or decisions, supports teamwork and, you know, just making clear communication with the healthcare team and helps identify and report ethical concerns, safety issues, or any changes in the patient's condition. And then let me see. The documentation, best practice. These are, LPN documentation, patient care. You gotta, document immediately after any interventions to ensure these records are accurate, complete, and up to date. So, you don't mistakenly forget to or write something, forget to write something down or anything. You gotta, make sure you keep it up to date. Using clear, objective, and professional language when charting patient conditions, behaviors, and responses to treatments. Recording information, important information such as vital signs, medications given, treatments that's performed, patient education, and changes of any conditions. Overall protecting patients' confidentiality by securing and handling medical records and only sharing information with authorized healthcare staff and using approved medical abbreviations, correct spelling, and detailed notes to improve communication and continuity, what is it, of care among the healthcare team. And then we have the scope of practice. This is Tiffany.
Okay, scope of practice. PNs must act under scope with direction from registered nurses, healthcare providers, dentists, etc. According to the Ohio Board of Nursing, LPNs are allowed to provide care as nurses by getting vital signs, collecting subjective and objective information, documenting all provided care given, documenting and doing assessments, whether general or focused, working with the RN. We all know RNs give the initial and we can do assessments after. Giving medications based on the NPA and the facility's policies, and evaluating the patient for potential health risks, and helping to contribute to the care of plan, which it's the RN's job to create, but the LPN contributes information based on personal efforts with the patient. According to Ohio, state and federal laws require LPNs to confirm and clarify orders that are compromised, missing information, such as medication rights, unclear, contraindicated, and anything along those lines that can cause or potentially cause harm to the patient. For instance, an LPN notices a medication order has the wrong dosage for a patient with a kidney disease, and so until further notice, they have to wait, hold medication, and contact the RN or the provider prior to administering. In the state of Ohio, the LPN, according to the BON, are not permitted to administer blood or blood products, give chemo or radiation, no TPN feedings, no IVN pushes, except for heparin or saline flushes in specific situations, and no medications pushed in a central venous line. LPNs can start a peripheral IV in the hand, forearm, and antecubital space. Therefore, in these IVs, the LPN can administer maintenance and antibiotic infusions, which are allowed by law, employee policy, and regulated by the BON to provide ethical and safe care to the patient. As an LPN, we are tasked to work under the RN, the provider, and etc. LPNs are given tasks to complete based on employee policy and what is allowed based on their scope of practice according to the NPA in the state they reside in. If the LPN has misunderstandings, miscommunications, or needs validation, clarification to move forward with caring for the patient, then it is best to reach out to the provider or the RN and have clarification, the information clarified. This is where the chain of command comes in. So if you don't know, you better ask somebody, in other words. If the provider is not reachable, then all orders are to be halted until clarification is reached. This is to protect the license of the nurse, the patient, and the patient's safety. Chain of command is for the protection of the patient, not just the nurse. We as nurses, whether LPN or RN, must advocate for the patient when it comes to their safety. According to the Institute of Medicine, medical errors are the #1 killer of patients, and we can reduce and prevent these things from happening by clarification and validating orders with the healthcare provider or the RN. If they are not available, speak with the charge nurse, etc. In conclusion, in Ohio, and it's not just Ohio, it's any state, we prioritize the patient and their safety above all. This includes HIPAA, which is to protect the privacy of the patient in their EHRs, EMRs, medical information. Patient autonomy, informed consent, and their right to be informed, to have informed information to make the right decisions as they see fit. Providing ethical care to the patient creates a trust or bond between patient and nurse, which leads to more accurate information, better patient care, better outcomes, tasks to tackle and delegate, reporting concern matters, and most of all, critical thinking to figure out the best needs of the patient. As an LPN, it is the duty of the nurse to reasonably, ethically, and legally practice within their range of scope with competency, the ability to critical think to make safe decisions in the best interest of the patient, to accurately document all accounts of care, and to rationalize the notion to inform the physician when the patient takes a turn for the worse.
And that's all that we have. Those are our references.
And those would be our references. Also, Dr. Ford, we saw Deanna's message late. She was having some connectivity issues, so that's why she wasn't able to log on. But the
She's
slides
here.
that I read, me and Adina, they were her slides.
She's
She was
here.
just having some connection issues. Okay, she's here?
Yes.
Yeah, but we saw her message late. I'm so sorry. That's
No,
our
that
Yeah,
bad.
I'm here
no,
right
that
now.
was good. You
I'm
all
so
pivoted. That's
sorry.
what you do. You keep going.
Mhm.
Now,
Okay,
do we?
thank
So
you.
we need to go back to that slide, Beeman, or what we need to?
No, we read it. I read it. Me and Adina read
I
it. So
know.
I read one and Adina read it. Mhm.
So I'm asking your group, do we need to let Beeman participate? Think about your rubric with
Yes.
presentation. Okay.
Yeah, that's
Yes.
fine.
And which ones were your slides? Let me see.
I think it's 6, 7, and 8.
Yes.
All right, Deanna, if you want to go over the importance of confidentiality.
Yep. Okay, so the importance of confidentiality. Patient confidentiality is important because it helps patients feel safe, respected, and able to trust their healthcare providers. When privacy is protected, patients are more likely to openly share important information, which leads to better communication and higher quality care. It also shows professionalism and respect for patients' rights. When confidentiality can be broken, these are like the examples for when confidentiality can be broken. Threats of harm to self of to self or others, suspected child, elder or domestic abuse, reportable infection disease like COVID, tuberculosis, STDs, court orders or legal investigations, medical emergencies when immediate care is needed, sharing information when healthcare providers involved in treatment, suspected neglect or unsafe living conditions, public health concerns or outbreaks when a patient gives consent to share information, and insurance billing or healthcare audits when required by law. Legal boundaries. LPNs follow state nursing laws, facility policies, and scope of practice guidelines. They also protect patient rights by obtaining proper consent and maintaining confidentiality, document care accurately, and promote to meet legal and professional standards, avoid practicing beyond training or delegated responsibilities, maintain professional nurse-patient relationships to prevent boundary violations, and also report unsafe, unethical, or illegal practices to help ensure patient safety.
Perfect, girl.
Thanks.
All right. Team collaboration at its best. You all communicated. You acknowledged communicating. Miss Amanda, she acknowledged it out loud. But you all kept going. You jumped in. So that this in the content was great. You all brought it, made it more real. And so hopefully this is just not just a project that you all are just doing for a grade. It is, but hopefully you take away from what your team has presented as a whole class, because you just never know. Ethical and legal issues, they're gonna come. So hopefully you can piggyback and think back about the presentation today. Thank you all so much.
All right,
Did
thank
a
you.
fantastic
Thank
job.
you.
Thank you.
All righty. Leadership and delegation. PN's shared governance. Get ready. So there is a square at the bottom with the arrow pointed upward, and whomever that wants to share, you can go ahead and share.
Sorry, I'm trying to figure it out. It keeps asking me to sign into like Zoom documents. I've never had to share anything before.
It usually don't ask that. But it might be your settings on your computer. So when you click the button, let me just do it with the arrow pointed upward. Let's see what happens. So all these windows pop up. I have entire screen. Do you have a selection? Do you have multiple things to select to select from?
Yeah, it says whiteboard documents or notes.
Um, Applications window is what I see. Do you see applications window?
No.
Okay, so it might be a different setting that you have.
Okay.
Okay. So team, I'm gonna be quiet and let you all decide what's next.
Mm.
So team, do we want someone else on the team to attempt to share?
They can try. I'm also looking to see if I can figure it out.
Yeah, I'm trying.
Okay. And all else fails, I can download it and share it, but I do want to give you the opportunity. And I just thought about it might be how you're logged into Zoom because I think you can log into Zoom via app or browser. That might be the difference too. And it also may be something with your settings or an upgrade um, with updates to Zoom because every now and then it does changes some stuff.
I think I got it.
Okay. And if not, my computer's trying to download it as well. I'm not sure how you would make that larger. Okay, you got it.
Yeah, I was waiting for someone to say, yeah, we can see that. So I was like, I really hope they can see this. And then I'm like, how do I make this bigger though?
We can see it and it is larger now.
Great.
Yes, I actually see your little the plus and minuses now. I didn't see it first, but okay, I'll be quiet.
Our project was over leadership and delegation.
Okay, and I had what is delegation and why is it important in healthcare? It improves patient safety and quality of care, helps manage workload and save time, allows team members to work efficiently within their roles, ensure nurses can focus on critical patient needs, promotes teamwork and communication. Delegation is giving tasks to certain trained healthcare team members so care can be provided safely and efficiently.
One of my slides was what are the roles of RN, LPN, and like an aide. So RNs do the initial assessment and the nursing diagnosis, and they also write out care plans where LPNs do more so focus assessments and kind of take tasks that the RN like say the RN has IV push, or you have an IV push and the RN asks you to pass her meds while you do her IV push. It's like a fair trade-off. And then they can reinforce teaching to patients, and they can delegate to like aides, which aides do ADLs, feeding, vitals, checking changes. But it all comes down to when an LPN and an aide work with an RN, it is like they work under the RN, and you must follow up that the care was done safely and correctly.
Okay, so when to avoid delegation. So basically, we want to avoid delegation when our patients are unstable or if they have had complex procedures. If it's like an initial assessment, stuff like that, we don't want to delegate stuff like that. And if it's out of our scope, out of the scope of practice. So we always want to verify like our Nursing Practice Act and the rules like in the facility that you're in and in the setting that you're in and the regulations to make sure that you are capable of doing what is being asked to do. Um, for accountability and responsibility of delegation, um, when delegating you are to make sure that the task is completing accordingly and properly executed while the UPA is responsible for the actions. So even if they're responsible for the actions, you're still held responsible for whatever you delegated that person to do. So you have to go back and make sure that they're doing that exactly like as it's supposed to be done. And then when we are delegating, we're responsible to follow the 5 rights of delegation, which is right task, right circumstances, right person, right direction, and right supervision.
Barriers to effective communication about delegation. Effective delegation and communication can be hindered by unclear expectation, psychological barriers such as fear of letting go, and assumptions about others' knowledge. 1. Fear of losing control. Build trust. You want to build trust with the patient, making sure that they are understanding what you're saying, making sure that you advocate for them, and your team as well. Doubts about team capability. Train, support, and challenge staff. Perfectionism, focus on outcomes, not perfection. Lack of time, invest time now to save time later. Poor task instructions, give clear instructions and expectations. Job security concerns, view delegation as leadership growth. And uncertainty about what to delegate, delegate routine tasks and keep high tasks. Why communication matters in delegation. It is important to communicate because it helps prevent errors, ensures tasks are done properly. Communication helps clarify expectations, and it helps build teamwork and trust, and it builds trust with your patients. Like if I say I'll come back in 30 minutes but I can't, I can see if I can ask the aide to just check in on the patient. And these are our references.
All right, another great presentation. Delegation, you all have heard that it's, we don't know what's on the Hesi, but they in the exit interview, students always leave information there, and they have left that delegation is huge. So make sure that you know those rights and don't change what the concept is, which is delegation rights to match. If it doesn't match what the concept is, for example, those 5 delegation rights are not there, then that's not going to be your appropriate answer. So delegation, we've heard, is heavy on the Hesi. I don't know, but that's what students have said. But nevertheless, it is something that you will be doing once you, get your license and go out and start practicing in whatever setting that you're working in. So it's something that you're going to need to know and understand as well. So great presentation, great presentation. All right, and we're down to, was it shared governance? Let's see, PN and shared governance. All right, just let us know what we need to do.
Professor Ford, quick question. When we are like side note while they get together, sorry. If they are we if we're gonna go like do a review of the Hesi, is there any way that we can touch on delegation today?
I think it's in a couple of our examples that we have. We have a couple of case studies. I think it's
Okay.
in those.
Okay, can you see my screen?
Yes,
I
we
can see
can.
it.
Yeah, okay. So we did our presentation on practical nursing and shared governance, having a voice in healthcare. During this presentation, we will explain what shared governance is, why it is important in healthcare, and how practical nurses can participate in decision-making, as well as how understanding organizational systems and reimbursement models helps to improve patient care and outcomes. And okay, so what is shared governance? Shared governance is a collaborative leadership model used in healthcare organizations, which allows nurses and other healthcare professionals to participate in decision making, which affects clinical practices, patient care, and workplace policies. Rather than relying solely on top-down management, shared governance encourages and allows teamwork, communication, and shared responsibility among staff members. The National Center for Biotechnology Information states that shared governance gives nurses a voice in shaping care delivery and improving patient outcomes. This approach recognizes that frontline healthcare workers have valuable insights because they interact directly with patients every day. And then why shared governance matters. Shared governance benefits both the healthcare professionals and the patients. Research published in the online Journal of Issues in Nursing shows that shared governance can increase job satisfaction, strengthen accountability, and promote evidence-based practice. When nurses are involved in decision making, they often feel like they are more valued and engaged in their work, which increases engagement and improve communication among team members, support professional growth, and contribute to safer patient care. When healthcare staff work together to solve problems and improve processes, patient outcomes can improve as well.
Practical nurses play an important role in shared governance, even while working within their specific scope of practice. Because PNs provide direct patient care, they're often among the first healthcare professionals to recognize changes in patients' conditions or identify recurring issues on their unit. Um, Observations made by the PN and their experiences are very valuable because they can provide real information about the patient, which can be brought to the RN. And it can also help in workplace challenges by sharing their concerns, reporting trends, and participating in discussions. And they can also help support continuous improvements in patient care. How can PNs get involved? There are several ways practical nurses can participate in shared governance. They can attend unit-based meetings, provide feedback to supervisors, participate in quality improvement projects, and contribute ideas for improving patient care. For example, if a PN notices an increase in patient falls on a unit, they can bring this concern to the healthcare team. Their observations may help identify contributing factors and lead to development of new safety strategies. These contributions ensure that decisions are informed by experiences by those providing direct patient care every day.
All right, it's your turn.
Oh, she's muted.
Sorry, guys. Um, so I did the reimbursement models. What are reimbursement models? Can I have the next slide?
I don't, did she read this one?
No, I just read the slide 5.
Okay.
Okay. So understanding organizational decision making. Healthcare organizations use structured decision-making processes to guide policies, allocate resources, and improve patient outcomes. These decisions are often based on patient safety data, quality measures, staffing needs, and available resources. The National Center for Biotechnology Information emphasizes that nurse input is essential because it reflects actual clinical experiences and patient needs. When practical nurses understand how decisions are made within an organization, they are better prepared to communicate concerns, offer suggestions, and advocate for improvements in patient care. Our reimbursement models. Reimbursement models refer to the methods healthcare organizations use to receive payment for the services they provide. Historically, many organizations use the fee-for-service model, which focused on the quantity of care provided. However, according to the Centers for Medicare and Medicaid Services, healthcare is increasingly moving forward. Value-based care. Value-based care focuses on the quality of care, patient outcomes, and overall patient satisfaction. Under this model, providers are rewarded for delivering safe, effective, and efficient care.
Oh, Jordan, if you could go back one. Okay. So then why it matters. Although reimbursement may seem like an administrative issue, it directly relates to the work of practical nurses. PNs help prevent complications such as infections, patient falls, medication errors, and avoidable hospital readmissions. These outcomes are often measured in value-based reimbursement programs. As a result, the quality of the care provided by the practical nurses can influence both patients' outcomes and organization performances. This highlights the important roles PNs play in supporting high-quality healthcare delivery. Shared governance organizational decision making and reimbursement models all connect to one common goal: improving patient care. The Agency for Healthcare Research and Quality emphasizes that quality improvement and patient safety depends heavily on frontline healthcare workers. Practical nurses contribute by monitoring patient closely, recognizing changes in condition, reporting concerns promptly, and following evidence-based practices. When PNs participate in shared governance, their knowledge and experience help shape policies and procedures that improve care for future patients. So then in conclusion, shared governance provides practical nurses with an opportunity to have a voice in healthcare decision-making by understanding how healthcare organizations operate and how reimbursement models influence care deliveries. PNs can contribute more effectively to quality improvement efforts. As future practical nurses participating in shared governance allows us to advocate for our patients, support our healthcare teams, and help create safer and more effective care environments. And then there are the references.
So another organized, professional, easy to follow presentation. All presentations were engaging. Okay, you really broke it down. So when you spoke about the shared governance being so important, and it is. So when you do your onboarding, sometimes they don't tell you about the other committees that you can work on. So make sure that you ask that. So you want to participate in that shared governance because it's not only staff satisfaction, but patient satisfaction, patient outcomes. It does affect the overall patient care. You all were mentioning observations. No observations because for the most part, the UAP and the LPN, we're the ones that are really spend the most time with our patients. So no observation is too small. We if it's the patient has been eating eggs every morning, then all of a sudden they're not eating eggs. Make note of that. If there's a change in their response, no observation is too small because then it helps us to be proactive for the most part rather than reactive. Great presentations. All right. Do we have any questions of the groups? If not, we'll move on to our Hesi information. Great presentations.
I was just going to ask when we could potentially see our grade for the group project.
Probably tomorrow. To say you all was just so outstanding. There's not much I have to need to write or correct or other than say just well done. So more than likely tomorrow. All right. So we started on last week looking at just going back and talking about the nursing process. So when we say analysis, let me share my screen here. Slideshow. Analysis, implementation, planning, and evaluation. Think about when we're analyzing, we're gathering all that information so that we can see if there's a connection and determine what's our next best steps. That's that implementation, determining what's our next best steps for our patient. That's that planning piece. But think about that collecting that subjective and objective data, doing that health history, that physical examination where we're listening to the lungs, we're gathering the vital signs. And we're looking at even the lab results, because that can be chart obtained, objective information. When we're planning, we're setting these goals and we're establishing expected outcomes and we want the best outcomes for our patients. Implementation, what are we going to do to ensure that this patient has the best outcomes? And believe it or not, sometimes even though we thought it through, we considered everything, some of our goals are not met. That's okay, but we need to acknowledge that, pivot back, we might have to gather more information. We may have to go back and plan, or sometimes the intervention that we're implementing, it just needs a little bit more time. But nevertheless, we need to be evaluated. That nursing process, it helps us to say patient-centered, keeps us systematic, and it helps us to be critical thinkers and pulling out that information that is going to be critical. Recognizing those cues. We have some case studies here, some questions coming up. And as you take your HESIs, as you take your NCLEX, look in the question scenario. As you take care of your patient, what are those observations? One group says reporting those observations, making note of those observations. What are those clues? There's, the observation clues are the same thing. And then is it something that we need to take action on, or is it something that we just need to make note of and keep a watch on? But that clinical judgment, looking at those clues and going back to your A&P, we're counting breath sounds and we're counting respirations, and the number is, greater than, we'll say the number is 30. Going back to your basics, what are those? How do we count respiration? Making sure that we're counting that rise and fall. And then in addition to that, if that number is out of range, what are our next steps? That keeps us safety, you all. That's another term that they said kept coming up. safety and delegation. So step back from the scenario and think about all things safety. And then so hopefully we can coordinate that care to reduce problems for our patient. We want to keep our patient safe and us safe. Let me just pause for a minute here. These other students in it. Just one moment. We'll just pause and let them all in so we won't have, you can clearly hear what we're saying. So for those of you that are just coming in, be sure to put your name and campus in the chat and also your professor's name because this recording will be shared. The chat will be shared as well. So good evening for those that are just coming in. Place your name, campus, and your professor's name in the chat. Give you a few minutes to do that. We've just completed our presentations, which I know you all have just completed you all as well. And we're just going back looking at our Hesi information. Okay, for those of you that are just coming in, good evening. Go ahead and place your name, campus, and your professor's name in the chat. Okay. So those nursing concepts is going to go back to coordinating that care, establishing those therapeutic relationships, and you using your knowledge base of what is safety, what's in your scope. It's going to be up to you. One of the group's presentation brought that out. Knowing what your scope of practice is. The facilities policies and procedure are going to match that. They should, but it's still going to be up to you to ensure that they're not asking you to do anything that's not within your scope of practice. And that goes back to that safety. So the organization rules and policies, their scope of practice, and safety. So topic, safe, effective care. Think about the client. Their blood pressure is elevated. Think what things in the realm of safety, how can we prevent this client from being unsafe? If the blood pressure is too high, sometimes people don't experience signs and symptoms with, abnormalities, but sometimes they do. Someone's blood pressure may be elevated and they may experience alterations in that mental status. They may not be fully aware of what's going on around them. How can we keep them safe? They may be off balance, unsteady. How can we keep them safe? So no matter what the scenario, if it's a safety question that they're asking, just step back and think, well, what signs and symptoms would this person be experiencing? And then how does that present this person from, put this patient in a situation that may cause them to injure themselves? Are we leaving those beds in the lowest positions? Are the call lights in reach? Are we following whatever those precautions that have been established for us to follow for that client? For example, are we following our airborne precautions protocol? Making sure, I think one group did bring out that HIPAA and confidentiality. There are sometimes when we're not going to violate and break any laws, because there are sometimes when information does have to be shared. But otherwise, we do want to keep confidential information private. Making sure that we're placing those receptacles. There are a lot of medication packets, and there's some documents and things that I know they're pretty much paperless, but there's still some paper and things that have identifying information on. Make sure that we're disposing those things in those appropriate receptacles. Medication administration, you all spoke about this. Taking the time to make sure that you go through those medication administration rights. If that order doesn't match, you all talked about it. We want to stop. We don't want to just go on. We've learned that there's supposed to be certain things present in order for this to be a correct order. Don't change what you know. If it doesn't match, we don't just go on and just haphazardly, we'll just go ahead and give this medicine and hope that everything will be okay. No, we stop. We clarify the order. And that's part of keeping that client safe as well. Just reviewing everything here. We're going to get to our case studies here in just a moment. So prioritization, you all, remember when you have those type questions, you're going to take care of all of your patients, but it's asking you which ones that we should consider taking care of first. And, we use ABCs, airway, breathing, circulation to guide that. And then next, food, water, shelter. And that will help you to identify, helping you to identify which ones we should take care of first. But don't think we're not going to take care of all of our patients. And we do have a slide. It should be coming up when you're trying to decide on prioritization, what's expected. So if a person has, we just mentioned hypertension, for the most part, we hope that blood pressure is within those normal limits, that 120 over 80 or close to that. But if we see that blood pressure is 140 over 90 or 140 over 80, we do say this person has the diagnosis of hypertension. We say they're on medication. So we do make note of it, because that would be something that we're going to take care of the client. We're going to still administer the medication, but that client might not be the first one we need to take care of right then. So making sure proper equipment, blood pressure cuff. This is one we have to find some. They have that standard cuff that's there, but in the event that a person's arm is that cuff is too small or too large, you will get the incorrect blood pressure. The blood pressure reading that you will get will not be correct. And remember, we're responding to these abnormalities, so we don't want incorrect blood pressure reading. So we need to take the time to find the correct cuff. In the event that it's not on our unit, we need to seek out where is the correct cuff size for this patient, because we don't want to be writing down and documenting, because this is this person's record information that's incorrect, which can also lead to medication changes. What it appears that this patient's blood pressure is low, but in fact, it's the incorrect proper size of the blood pressure cuff. So then this patient will have a medication change based on what's being documented, but in fact, we really know that these blood pressure readings are incorrect. So safety, just thinking it all through. It seems like it's small, but what is it? Not that big of a difference in the size of the cup. It does make a difference. It is not the correct size. We have even started measuring the person's arm, and because I don't know if you noticed, but on the blood pressure cuffs, there are numbers on there, and they have like centimeters or inches. Some have both, but we've actually started measuring the patient's arms and then selecting a cuff size based on that. So legal and ethical, that is, we just can't avoid that. Situations are going to arise, but knowing what your nurse practice act says, following your delegation rights, following your medication administration rights, taking the time out to prevent these sentinel events. Persons coming in for surgery, and most facilities have a procedure where you stop what you're doing and you go back through making sure that you have the correct patient, the correct extremity, and so forth. Taking the time to follow those policies and procedures lessens legal and ethical actions, but it is real. Legal patient or family members can bring legal things against you as well as the facility that you're working for. So we want to make sure that we're doing what we need to do to protect ourselves. Delegation, we said that knowing those 5 rights, and I think we do have some slides coming up around delegation. Knowing your scope of practice. So thinking like a nurse, here we go. Here's some more tips. We're narrowing it all down. For those of you that are just coming in, if you have not placed your name, campus, and your professor's name in the chat, please do so. All right, so I'm just going to let you look at this slide entirely here. Just kind of gather what it's actually saying. So this is a test-taking tip, how we look through and determine what's the next step or the best answer for the question. Just give you a moment to look at it and we'll talk about it. Okay, so what is this question type? Is this a definition, or they wanted me to select, is this a priority question? What do you know about the topic or the concept that's in there? Is it, are we talking about delegation? So then you go back to, well, what are my 5 delegation rights? Or is this question about a patient that has a chronic disease process, or this client is presenting acute signs and symptoms? Okay. So, and you can, even as you're reading through your scenario, visualize what that client will look like. Go back and recall what your normal lab values are, your normal vital signs. What is the normal respiratory rate? What is the normal blood pressure? Okay. Also consider the time. If the question is asked, if the scenario is 5 days or 3 months, that is different from 1 hour post-op, for example. If this is a new admission or this is a transfer from ICU to med surg or vice versa, or if this client is just 1 hour post-op, 30 minutes post-op versus a client being 3 months out. Our responses are going to be a little bit different. And also the client signs and symptoms more than likely are going to be a little bit different. Because if a client is just maybe like 15, even an hour post-op, those nerve endings are waking up, especially if they have been in surgery, they have been put to sleep. And they had some type of surgery where something was cut on, those nerve endings are waking up. That patient that's an hour post-op and 7 days post-op, probably both are going to experience pain, but that pain's going to probably be a little bit different. That patient that's an hour or two post-op, that pain probably is going to be a little bit more intense than that person several days out. So, and I always consider the growth and development. Who are you talking to? Is it an adult? Is it, pull on your geriatrics? Is this a pediatric patient? Is this a expected mom, or is it postpartum? Consider the age of the patient as well. Okay. All right. And so Maslow used the hierarchy. The highest priority is what we just said. Food, water, and shelter. If airway, breathing, and circulation, if that's okay, that person does not have a problem with that, then we go to those physiological needs next. This helps us to determine priority. This is just another way to think about it. Okay. We're at our first hour. We do want to stop and take a 5-minute break. And so, because we'll push our other time toward the end, because I want to make sure we get through these PowerPoints here. So return at 6:39. And do remember that this recording still plays, so make sure you turn your cameras off and make sure you're on mute. See you at 6:39.
Excuse me, hello. Teacher.
Yes.
Miss Morton, I have to X out and then come back in because sometimes my device it'll overheat. So is it possible that I could sign out for my 5 minutes and let my phone cool off?
Sure.
Okay.
Okay. All right, let's go ahead and get started here. Go ahead and get you a sheet of paper or something to jot note on because we're going to go ahead and start looking at our sample questions here. So we do want you to be taking notes and jotting down some things. Okay, so we said another way to think about it when we're trying to determine priority is ABCs, pain, look at the education, the well-being, coping in normal versus abnormal findings. It's just another way of looking at it. Okay, ABCs, and then we added the S, safety. It's big on safety. Examples that we gave, the person with hypertension, it could also be a person that is post-op, they had a knee replacement, a hip replacement. That client more than likely is not going to be able to move those extremities like they had prior to surgery. So how does this client turn or reposition? You know, what do we need to have a call out and reach, be the lowest position? You know, is this client allowed to stand, to bear weight? No, don't bear weight. So what do? We need to clearly ensure that we have orders that address, you know, what things the patient can be doing or not. And if the patient cannot bear weight, you know, if this client needs to use the restroom, if they've had arm surgery, this client needs to eat, what are those things that we need to do to provide that care or to assist that client? Okay. And then another way, rather than saying airway, breathing, and circulation, out of your scenario, which of these patients are more likely to pass away first? That's going to be the priority. We're going to take care of all the patients, but remember airway, breathing, and circulation, and we want to always consider safety. Okay. So I'm going to take the time to read through this. Go ahead and get you some paper, a pen, because we do want you to identify your correct answer before we start, and also the rationale. You know, oftentimes you look in the NCLEX book, you know, you have the correct answer and they have these rationales listed. I want you to be able to do some jot noting with why you're selecting that answer. So to prove minimum competency, a beginning nurse must demonstrate ability to make appropriate nursing judgments. We need to be able to recognize both expected and unexpected outcomes. You know, this client has diabetes. Some of our glucose readings, they might be out of range. The hemoglobin A1C might be out of range. It may be coming more back to the normal range because this client is compliant with medications. They're compliant with those lifestyle modifications. But what is expected versus unexpected? The client has hypertension or diabetes, and this client is complaining of chest pain. Is that expected? Is that an expected symptom, or is that unexpected? Okay, outcomes. Allow the nurse to evaluate whether goals have been met. What is the expected outcome of your action? We administer these medications. When we do address and change, what do we expect that wound to do? To heal. So at some point in time, if that dressing is being changed as it should be, and also the correct medication is being applied, that wound should lessen in size. That wound should heal. That skin should heal. What is the best action for the expected outcome? You know, does this wound require being changed only once a day, every shift? Will it help or hurt the situation? So it depends on what that wound bed, and this is just one scenario. It depends on what that wound bed looks like. Sometimes that repeated pulling off or removing the dressing aggravates and causes further injury. So therefore, you might see some dressing changes only once a day, and then some it might be more than once a day, every shift or twice a day. Is it desired? These are just some questions that you're just going to be asking yourself. Is it the credited answer? If I can only do one thing and then leave the room, which of these interventions would you select? A, B, C, or D? Would you do? Okay. All right. So I do want to give you time to read through the question, select your answer, and then just do some jot noting. You don't have to write a complete sentence as you are explaining to yourself, or you're leaving your rationale, so to speak, why that is the correct answer. So we'll give you time to do that. Give you me. I'm gonna go on mute. I'm gonna put a timer on. So read through, jot down 1, 2, 3, or 4. what your correct answer is, and then do some jot noting as why you selected that. All right. And the timer is going to start. Okay, 30 more seconds. So you're selecting your correct answer, and then you're writing the rationale. You're doing some jot noting. This is going to reinforce what you know.
And you don't want the rationale in the chat, right? You want us to just write it on our pen on paper?
Just for now, just put it on your paper. We'll share out in just a moment. We'll mix it up a little bit. We'll have you all to respond verbally, chat, and on your paper here. So right now, let's see. Get back to the PowerPoint. Okay, so check what you got, and let's see. So we have a client who complained of pain. Which client complained of pain should the nurse respond to first? We're going to take care of all of our patients. Think back about the test taking tips, what we said. So number 3, bladder pain while receiving a continuous saline irrigant 2 hours after a transurethral prosthetic resection. So this is unexpected. So think about that time frame. This incisional pain on the 3rd day post-op. This person had surgery. They requested, pain medicine, a PRN pain medication. But this bladder pain while receiving this continuous irrigant 2 hours after, that's kind of unexpected. So go back to your med surge, your procedures, and all of that. Call that information. Is this expected or unexpected? All right. Let's need to reset my timer. This one too, we'll just let you do some jot noting. Select the correct answer and then do some jot noting. Write down your rationale why you're saying that's the correct answer. Okay, 30 more seconds. Make your selection. Read through the scenario. Determine where this client is. What is it? Is it something? I'm not trying to tell you what to focus on, but is there something that we need to be focused on in this scenario? And if so, pull that out. Are there other things we should consider? Delegation. What are those 5 rights of delegation? Are there some words that we should consider? New. Okay. All right. Let's see how do we do this though. See how we fared out. Okay. So someone tell me, why didn't you select perform full range of motion on all extremities? You can come off mute and tell me.
Um, this client is a new risk for osteoporosis, and you don't really want to sit right there and perform a full range of motion on a person with a new diagnosis.
What is osteoporosis?
Osteoporosis is
And anyone can jump in.
Weakening of the bone.
weakening of the bones.
Those bones
And
are
loss of the bone
soft.
mass. Yeah.
Exactly. Those bones
Deterioration.
are soft, and this person's at risk for what? If this person goes in and they don't do the range of motion how it should be done, this person's at risk for what's happening to those bones. They could do what?
And probably
A
breaking.
fracture or a break.
They could break, exactly. So look, that's why I was saying, look for those words. Are there any words? Because that'd be different if this client was not newly at risk. This was a chronic condition. We've identified, we have lifestyle modifications for him. We're asking the patient to walk. We have the calcium supplements and all the other medications and things that this patient's on. They're stable. That'd be different. But this person is new. So think about those words that are there. All right. Okay, so active listening, we talked about these, I think in week 1 or 2, the restating, the clarifying, just to ensure the information that we're receiving from the sender is correct. Because there are times when we talk, there's a receiver and a sender, and the information that's sent is misinterpreted. Either we didn't clearly understand what they said, or it was just total, we just may just not have just understood for a background noise. It could have been, it might have been on a level that I could understand and things like that. But nevertheless, active listening does include that restating, clarifying, reflecting. And we do want to use that minimal encouraging so that client can tell us more information so we can make those informed decisions when we're planning for interventions for this client. And this one right here, we're not too comfortable with for the most part, but remember, remaining silent. It is active listening. It's allowing that client to tell us whatever it is that they want us to know. Negative communication, the one that we pretty much familiar with all of these, but the giving advice, because they're going to always be saying, well, nurse, what would you do? But we don't want to give advice. We want to make sure that patient makes a informed decision. They ask us that, well, hey, are there some questions that you specifically have about the information or the decision that you're trying to make? Because we can bring the doctor back in to go over it again with you. We can bring the dietitian back in, or whomever, which other person on the healthcare team that it does involve. But we don't want to give our opinion for the client. And of course, false reassurances, belittling, and things like that. We know that's all negative communication. All right, so here we go. Let me put my timer on again. Make your selection. This time, put it in the chat. Just drop 1, 2, 3, or 4. And then on your jot noting, just jot down why you think that is the best answer. Here we go. Okay, 20 more seconds. So drop your answer in the chat, 1, 2, 3, or 4. Just put the number there. And then on your paper, do some jot noting as why you selected that answer. Okay. So here we have the practical nurses observing an unlicensed assistant personnel provide care for a client in an assisted living community. Which action by the UAP should the PN determine is safe for the UAP to continue? So this question is about delegation, scope of practice for a UAP. Then the question is more specifically is saying determine is safe. So we're going to select an answer that is correct or matches or that's within the scope of practice or is okay for the UAP to do. And you can reword that. And I was just using those different terms because they all mean the same thing. It matches. We have correctly delegated. Is safe. So we don't want to select, we do not want to select something that is out of the UAP scope of practice because that will means that it is not safe. So the question is asking us, it's a delegation question, and it's the UAP's scope of practice determine is safe. So we're picking something that is correct, that is okay for the UAP to do. Okay. All right. Obtain vital signs for a client who takes blood pressure medication. Why did we not select gives an initial dose of antibiotics to a client with a fever?
Because we can't give medication out as a UAP. That's out of the scope.
It does not match. It is not safe. Got it. Great. All right. So here we go. Put my timer on. Put your number in the chat. $15 more seconds. Just put your number in the chat. 1, 2, 3, or 4. Okay. Implementation. All right. So who do we see first? Remember, we are going to take care of all of our patients. I'll give you a little bit more time on this one. So on this one, in the chat, you can just drop their name, put Harry, Naomi, Peter, or Pam, whichever you decide. But on your paper, jot note why you selected that one. Give a little bit more time and just make a note as to why you did not select the others as well. Okay. And start. Who do we see first? Harry, Naomi, Peter, or Pam? So you're gonna select who you're gonna see first. That answer you put in the chat. You just put Harry, Naomi, Peter, or Pam. And then to take it a step further, your jot noting, of course, write down why you selected that person. And then for the others, why did you not select that person? Let's see who we gonna take care of first. Okay. So we have Naomi, Peter, and Pam. Okay. So, yeah, yes, Naomi, Peter, and Pam. So for sure, we're not gonna see Harry. Is what I'm looking at. What you all are saying. No one said Harry. Let's go back to our scenario here. Okay. All right, and so we are going to see Naomi first. So someone come off mute and tell me why you did not select Pam. Why would Pam not be the person we would see first?
Because those
That's
are already the
expected.
symptoms of liver failure. Those are
It is.
symptoms.
It is expected. Exactly.
Right.
Remember we said those one of those strategies when you're looking at the scenario, look at expected versus unexpected. Is acute versus chronic? Yes. So go back to Ms. Serge. This person has liver failure. Go back to A&P. What is the liver supposed to do? And when it's not functioning like it's supposed to, what happens? All those toxins build up. And as a result of that, that client's skin gets jaundiced and starts to look yellow. Those toxins are still in the body. So that person's gonna have altered mental status, gonna have some confusion. So that's expected. Okay, now someone come off of mute and tell me why we would not see Peter first.
Because it's expected.
Exactly. It's the same thing. Go back to what the Crohn's disease is. Which body system? It's mostly the GI. When someone has Crohn, it those signs and symptoms are those frequent watery stools and this blood pressure. It's pretty much within range for him. Now, someone come off mute and tell me why did we select Naomi?
Because Naomi's running. Oh, go ahead.
Is
No,
it
go
the
ahead.
pain or the fever?
It's the fever. That
It's
means she's
the
fighting off an
fever.
infection.
It's the fever. Yes. That temperature. Good, good, good. So that method, what we just did, if you're having a hard time picking out the answer. So ask yourself why you would not select those other answer choices. So that was a test taking tip that we just did. Because sometimes like, oh my goodness, which all of these people, all of these answers, they're the same, they're almost the same. I would want to take care of each of them, but there's only one best answer. So determine why you would and why you would not see that person first. Okay. All right. So here we go. What are the most common reasons that a new grad loses his or her license? Failure to notice or recognize, failure to act and respond, failure to report and communicate. And so when we're getting those phone calls from lab, radiology, we're answering that phone and they're saying, hey, we're calling about the patient in room 201. We're calling about their white count. We're calling in their x-ray results. We're making note of that, but we also need to respond and report that. We have to communicate that to either the team leader, who's ever designated task that is that day, to notify the healthcare provider. It is not just good enough for us to take this information down and make note of it. More than likely, they're calling anyways. It's something abnormal, and more than likely, is abnormal to the point where we need a action pretty quickly. So don't just take that information and put it in a chart. So that's the thing that you need to ask too. Especially if you all are changing out charge nurses and tasks throughout the days that you're working, just make sure you identify who do you report to in the event that something happens. It might be that day is your turn. So just know that you remind your team and you remind yourself also, hey, I need to report this. If we get calls or information via fax, sometimes facilities have different ways of receiving that information, but nevertheless, we just don't tuck that information away in that patient's chart. We have to report it, notify someone, communicate to the healthcare provider or whatever that chain of command is in the facility. Okay, so these are principles of ethics. I think we talked about these probably week 2. So this negligence piece. So remember, you have 4 pieces, 4 components. So we've created this care plan and we decided that this client in patient in room 201, they need assistance when in the shower. When they're in the shower, assistance of 2 persons. The patient is assigned to you. Okay, so you Go in the patient's, you and the patient are in the shower, and also an additional staff. And then you get a phone call, or the other person that's assisting you have to step away. The care plan says, which is the roadmap of how to take care of that patient. It needs two persons for turn and repositioning, for walking in the corridor. It could be whatever that care plan has outlined. We want to make sure that we are adhering to those steps, those interventions, because that's our duty. Those are the things that we're supposed to do for that client. In the event that we are not doing those things that we're supposed to do for that client, and that client ends up with some type of injury, and there's approximate cause, there's a direct connection to that injury that client sustained, and what we did not do, then that means that we are negligent. If we did not properly delegate, if we didn't go through the five rights, if we didn't ensure, one of the groups presented earlier is making sure that is within that scope of practice for that UAP, within their scope of practice. If we're not ensuring that that is there, and we don't properly delegate, then this client ends up with some type of damages and is directly related or connected to that, then we are deemed negligent. And then that's where we get the ethical and the legal aspects comes in. So just making sure that we have whatever's outlined in that care plan. And if it's not working, that evaluation piece, that's what we say, hey, this is not working. This goal hasn't been met. And then we go back and rethink through, what do we need to do differently? Because we want to protect ourselves as well as the clients. Okay, so we have another question here. Let me put the timer on. Just do some jot noting. All right, let's see. Okay. So stop my time here. Mrs. Stone is recovering from pneumonia. What is pneumonia? What body systems? What's going on? And has been receiving steroid and antibiotic therapy. What happens when someone takes steroids? Are there any precautions that we need to be thinking about if someone's on antibiotic therapy? She has an indwelling urinary catheter that was placed 4 days ago. Although being afebrile, what does afebrile mean? For 24 hours, this morning her temperature is 99.9. What does afebrile mean? What does this 99.9 temperature mean? Okay.
Yeah.
Without
Go ahead.
She was without a temperature for 24 hours, and then all of a sudden now she got a temperature. So that's concerning.
Okay. So how I just went through that scenario, like what is pneumonia? You didn't tell us her age. What the medications that we're given, just dissect everything. Just piece it all the way out for 24 hours. Okay, but now they're saying she's this. Okay. Delegation to a nursing assistant, ambulation, vital signs. I think one of the groups you all did talk about this. Usually all those activities of daily living. Those are things that they can do. We do not delegate assessment. We do not delegate communication with the physician, disease education or reinforcement. medication administration, sterile techniques. We are not delegating these things. Okay. Uh-oh. So let's go back to Miss Stone. Let's look at this question here. We can come off mute and answer. It says, what are some areas of education the LPN should reinforce with Mrs. Stone concerning pneumonia? So we're reinforcing education so that she can either get better and or so that pneumonia doesn't come back. So what are some things that we're telling her? And you can come off mute
She
and
got
tell.
to
Make sure she
increase her
complete all her medication.
Take medications as prescribed. What was the other thing?
Increase her intake of liquid.
Fluid intake, because we know that helps washes and keeps things moving. Unless it's contraindicated. Yes. Someone else. What else are we telling Miss Stone concerning her pneumonia?
You can use her incentive spirometer to help her breathe.
Yes, help those lungs fully inflate and deflate, expand and recoil. Exactly. Good. And then also about the virus transmission, we don't really realize, hey, someone can catch, that it can be, transmitted. So making sure that if they're coughing up, phlegm, that they're disposing of that properly, hand washing, taking those frequent breaks, because if someone has a problem with a disease process is affecting their gas exchange, more than likely they're going to get tired. And so we do want to encourage those frequent breaks. In the event that they're tired, can't catch their breath, they're more at risk for falling, and so we got to be thinking about safety. So something as these things seem simple, cough and deep breathe, get that fluid, get that extra fluid in that out of the lungs, taking those frequent breaks. It may seem minimal, but these things keep the patient safe and helps them get back to that healing so that those lungs can heal. So rights of delegation, we know these. So when you're selecting a delegation, when you have a delegation question, go back to what those 5 rights are. Do we have the correct person? Is this within this UAP's scope? Have they been checked off on it in the facility? Ensuring that we're communicating what we want this UAP to do. Be specific every 2 hours at 8 a.m. and 10 a.m. Making sure that it's a correct task, the correct circumstance. Is it this client stable versus unstable? And remember, we're not relieved of it just because we delegated. We still have to go back, supervise, and evaluate. All right. So we'll give you a few minutes on this right here. So in the chat, just drop your numbers. Which of these assessment findings indicates a positive expected response in a 35-year-old recovering from pneumonia? So think about what this question is asking you as you first before you go and select your answer choice. You put my timer on. Just drop them in the chat. Just put 1, 2, whatever your numbers are. And what is this question wanting you to select?
Is there only one answer?
No, it's 3 of them. I think it's 4.
So think about what is the question asking you. Which of these assessment findings indicate a positive expected response in a 35-year-old? I know you want a number. This is select all that apply. This is select all that apply. And so just read each one. But then make sure you're selecting a positive expected response. Move this back. As you select your answers, so I just want you to pause for just one moment. The question says, which of these assessment findings indicate a positive expected response? So are we selecting answers that indicate this client is getting better or this client is getting worse?
Better.
Okay. All right. Go back and read your answer choices and then drop them in the chat. All righty. So let's see what did we do here. So again, read through that question. Identify what it wants you to answer. Because sometimes if we jump to the answer choices, we're already focused on whatever those answer choices we're thinking those answer choices are saying. But go back to that question. What is this question asking me to answer about the scenario? So we knew that the client had pneumonia. So we have to recall about what is pneumonia, what body parts, which organs, which body system is mostly affected. Okay, so for the most part, we have 3, 4, 6, and 11 and 12. And then we're matching, well, what is it that they want me to answer about the scenario? Then we said a positive expected. So we're looking for things that indicates this client is getting better.
Before it's not positive.
And versus the client getting worse. Okay. So let's see, how did we do? Uh-oh, trying to move to the next slide. Okay. So why did we not select heart rate changes from 102 to 110? What's wrong with that?
It's picking up.
Okay, so we go back to what we know the norm is. The norm is 60 to 100 for an adult. Anything over that, the 102 was abnormal, but now it's even more. Why did we not select JVD increases?
Because that's not good either for it to increase.
So what is JVD? Jugular vein distension. What's going on when a person's veins, you see those neck veins sticking out?
Fluid overload.
Overload, exactly. So what would make number 9 a positive change? What would number 9 needed to have said for this to be a positive change?
Edema going from 4 to 3.
Got it. Good. So again, we identified the question. The question was asking us to pick out something that was positive, that indicated this client was getting better. Good. Okay. All right. So here we go. Here's another one. All right. I'm not gonna give you as much time on this one. You can just drop it in chat. 1, 2, 3, or 4. Okay, here we go. Immediate response. We just said fever was of concern. This client is taking antibiotics. What is pyelonephritis? Which organs? This client is something's going on with their urine, their kidneys, the urinary system. So all these other things more than likely probably going to be expected. Even with, a lot of times when people take antibiotics, they get nauseated. The cloudy urine. This is another expected versus unexpected. It is not expected that someone has a fever. And then it says nurse's immediate response. So we're going to address all of these things: this client being nauseated, the urine being cloudy, and them being anorexic, not wanting to eat. But it says immediate response. So that would be the fever. Got it. Okay. All right. So give you a little bit more time on this. Just jot it down, but then also in your mind, just think about why you selected 1, 2, 3, or 4. Okay, let's see. How do we do? Okay. So that the question it says the nurse would question which part of the teaching plan. So if we're questioning something, are we looking for an answer that is correct or incorrect?
Incorrect.
Exactly. So if we're questioning something, if the question would have asked us, says from the following, select a statement that indicates the client needs further teaching, we're selecting something that's incorrect about the situation. So that's why I said go back and see, what is this question asking me to answer about this concept? So here it says the nurse would question what part of the teaching plan. We're not questioning anything that's in the teaching plan that is correct, because it's correct. We're good on that. But we would question that information that is incorrect. Okay. So go back to that question stem and see what is it. Just like we did with the previous question. It says positive expected outcome. So something that shows improvement. All right, here we go. I'm gonna go on mute. We just give you shorter time on this because we should have picked up with our reviewing and everything. Here we go. Okay, so recall. Okay, first of all, let's look and see what this question is asking us. This is which finding with the RN instruct the LPN to report immediately. So let me stop our timer here. So this is something that is priority. So go back to ABCs and safety. Remember that slide said who's going to die first. What did the other slide say? And then we look at what's expected versus unexpected. So it's saying priority. Let me see what did you all put in the chat. Let's see. Which one of those things indicate priority? Looks like we said number 3. So what is it about profuse sweating, perspiration in a person that has diabetes? What is it?
That means that they have hypoglycemia and it's very, very low. Like their blood sugar is very low.
Okay. Got it. Good. Okay. Here we go. Delegation questions. Select all that apply. I'm gonna give you a little bit more time on this and read through. Let me go on mute. 10 more seconds. Okay, so we have a care plan for a client that includes all of these interventions that are listed. Client 78 years old, they have Parkinson's. But then the question narrows it down. It focuses on delegation to a UAP. So which of these tasks can we delegate to the UAP for this 78-year-old that has Parkinson's? Okay. How did you do? All right. Good. Here we go. Okay, so we have a 23-year-old client with a recent history of encephalitis, and they're admitted to the med-surgical unit. They have new onset of seizures. Which nursing activities included in the client's care would be best to assign to an LPN whom the nurse is supervising? Okay. Observing and documenting the onset and duration of seizure activity, administering the medication as prescribed, turning the client to the side to avoid aspiration. Okay. So why would we have not chosen developing a discharge plan that includes referral to the Epilepsy Foundation?
Because we don't do a discharge plan. That's the RN. It's out
Yes.
of our
Got it. Great. Remember it. Go back to that question. It's asking about what can the LPN do. Okay. So these are things that are all in this patient's care plan, but it asks you specifically about the LPN. Great. Here we go. Another.
I have a question of back on that one.
Mm-hmm.
It confused me because it said it's a new, if you go back to the question, it's new onset, like it's a new, like if you go back to the question,
Mm-hmm. The
it
client has
says
new onset of seizures. Yes.
new onset. Uh-huh. So if it's something that's new, are we still allowed to like do the observation and the documenting of the seizure?
Exactly. We're going to still be observing and documenting that client. And then if they're
Okay.
having a seizure, we want to know how long that seizure's lasted.
Okay. And then the medication is because it's already been established and it's just like a ongoing medication, correct?
Exactly.
Okay.
Yes. Okay. And what about the turn the client to the side? What does that do? Well, it says help to avoid aspiration. Is there? Never mind. It does help avoid that aspiration because sometimes those clients, most of the time when they're having those seizures, their mental status has deteriorated, and so sometimes their cough. A number of things can happen when someone's actually having a seizure, but it lessens the chances that client aspirate, which we know is not good. Okay. All right. Here we go. Okay, 10 more seconds. Okay. So it says, so administering nitroglycerin sublingual if chest discomfort occurs during client activities. So what is happening? What happened? What's this myocardial infarction? What is that? This client has had a what? They've had
Heart
a
attack.
Okay.
heart attack. Exactly. And so they're experiencing the fatigue. Remember, that heart is not pumping like it's supposed to. And so that fatigue and the chest discomfort, a lot of times they will still have that chest discomfort. And so, why did we not select teaching the client energy conservation techniques to decrease myocardial oxygen demand?
We don't teach, we reinforce. Teaching is for the audience.
Okay. So, what about why didn't we select collecting pulse, blood pressure, and oxygen saturation before and after client ambulation? Let me go back to the question. You can see. Does it
Because
really
there's
go ahead?
no cardiac issues. He had a heart attack 3 days ago, so there's damaged tissue.
Mm-hmm. So, what did you say? There's damaged tissue. So, why did we not select number two?
Because there's known issue, so you would give the nitro.
Exactly. And some answer choices you all are just placeholders. It has nothing to do with what's going on. That's what she's saying. This is about this client having a heart attack. That blood flow to that heart, that part of the heart has ceased. That part of the heart is not functioning like it's supposed to. So yeah, if you read some answer choices, like, wait a minute, this doesn't have anything to do with the question is at hand. More than likely, it is just a placeholder. So don't try to make it match. Now, you might have been kind of fooled when you said pulse and blood pressure and heart attack. And this says before and after the client ambulating. What does that have to do with what's going on with this client? Okay. Yes, his client the client 3 days ago has been reporting fatigue and chest comfort when ambulating, but still remember what is a heart attack and turn the timer off. That part of that heart has died. It's no longer functioning like it's supposed to. So our oxygen is not getting to our brain and down to our baby pinky toe like it should. So it's expected this client is going to be experiencing that fatigue and chest discomfort because part of that heart muscle is not working like it's supposed to. So I said all that to say that some answer choices are just placeholders. They have nothing to do with what's going on in the situation here. All right. So we do need to stop and pause and take another 5-minute break. Okay. So let's see, what time is it? 7:30. What it is, 3. So come back in at 7:39. 7:39. Remember, this recording still plays, so turn your cameras off and make sure you're on mute. See you at 7:39. if you have not placed those of you that came over from Dr. Tenz's class, make sure you put your name, your campus, and professor's name in the chat. Okay. So as we read the question, read it carefully because a lot of times it has all this information in there, but the information is just information. It's not information such that it helps you to answer your question. So read through carefully, sift out what is needed, identify what the subject or the concept is, pick out those keywords. A keyword could be all, it could be, like we just said, positive, what was it? Positive expected outcomes. And we said that meant when we looked at the assessment findings, anything that indicated that client was getting better. If we're questioning something or if further teaching is needed, then that means that something is incorrect. Pick out those keywords, but all, what is the question really asking you? What is it asking you to answer about that concept? Answer choices, multiple choice. Read each answer carefully. Remember that only one answer is correct, unless it says select all that apply, then you select multiple. But if it's saying, select the correct answer, there's only one correct answer. What is the desired outcome? Think healthy, health, safety. And then know your scope of practice. Like those questions I just asked you all, why did we not select that answer choice? It wasn't in our scope of practice as a PE. Priority questions, all answers may be right, but only one is best. We're going to take care of all those clients. All of those interventions are things that we could do, but it's asking you which one do we need to do first. Think, if I can only do one of these, which is the safest and the best for this client? Okay. Here we go. Now we should be picking up on our speed of reading through, sifting through. So I'm going to shorten my time. And you can drop it in the chat, 1, 2, 3, or 4. Okay. Before orange juice or insulin is given, the patient's blood glucose should be checked because we need to see what we're dealing with, what numbers. It's unlike the other question when we said that client was profusely sweating. Dizziness could be something else outside of diabetes. So we do want to make sure of what that is. What's really making them dizzy? Is it because that glucose level is too high or too low, or is it something else? So we do want to check and see what it actually is. Okay. All right, here we go. And see what you all are selecting. Okay, let's go back. Why are we selecting client number 3, you all? Then
heart
your
rate
own,
48.
exactly, in your own words. So it says assess first. We're gonna take care of all of our clients, but this is first. So we're selecting client 3 because that heart rate, that norm for an adult, this is 58-year-old, it should be between 60 to 100. We do have those that are really athletic, and sometimes it drops below that 60, but 48 is of utmost concern. That's a significant low heart rate. Okay, here we go. Let's get my timer. Okay, let's see. So, which patient should the charge nurse assign to the care of an PN under the supervision of an RN team leader? The 83-year-old that has type 2 diabetes with chronic obstructive pulmonary disease. So the 83-year-old has no complicating factors at the moment. Providing care for the patient is stable and she is uncomplicated condition. So they're stable, falls within our scope. Why would we have not selected the patient that has number 4? Why did we not select patient number 4? What's going on with patient number 4 and patient number 1? Are patient number 4 and number 1, are they the same patient, or do they have the same scenario? So patient number 1 and patient number 4 are essentially, patient number 1 and number 3, I'm sorry. No, patient number 1 and number 4, they're essentially the same. They both of acute. They got something, this patient has just undergone. So they have just had some surgery done to the adrenal gland, fresh. Patient number 4, they have this mental status change and they just were admitted. Patient number 3, why would we have selected patient number 3? Why would we have not selected that one?
Because you're preparing for
Get ready to
discharge,
go.
so you're more than likely going to need teaching.
Exactly. It doesn't change that we don't do that initial teaching. It's reworded. It's a different type scenario, but don't be fooled. Just make what you know. We reinforce. Great. And then if 2 of your answer choices are just alike, then of course, we only have to select one answer. So we know we can't select those 2 because they're alike. Okay. You all are speeding up. So this is pretty good. All right, here we go. We put the timer back on. Y'all can hear me. Which patient are we selecting? Which scenario? Let's see. You all are selecting number 1. All right, let's see. I have to stop sharing and reshare. Hold on. So the assistant personnel, which finding with the nurse instruct the AP to report immediately. So it has to be something urgent that should be priority. That's going to require a quick response. Okay. Again, that fever, that's not expected. It requires our immediate response. So we do want them to report that. Okay. So the nurse is caring for a client with varicella and advise the UAP to take which precautions when caring for this client. Which PPE are we advising the UAP to take, to use? Okay. We go back to what is varicella. Okay, so they're gonna need the gowns, the gloves, and the mask. Okay, because we do know that it is airborne, and if someone comes in contact with it, it can be sprayed. Okay, good. All right, this one you probably need a little bit more time with. The nurse prepares a plan of care for a client receiving chemotherapy treatment with intravenous bleomycin sulfate. The nurse would document which priority intervention in the plan. Priority question. Think about what helps us to determine priority. ABC and safety. Airway, breathing, circulation, and safety. See what y'all are saying. Which one of those equals ABC? Yep. So tomato, airway, breathing. Breathing is, what is dyspnea? What's this person experiencing? What's another word for it?
Shortness of breath.
Shortness of breath. Great. That's airway. Good. Okay. A child diagnosed with pertussis, whooping cough, is being admitted to the pediatric unit. As soon as the child arrives on the unit, which action would the nurse perform first? Again, priority. We can do all of these things, but which one should we be doing first? Client has whooping cough. What do we know about whooping cough? And it's asking, what should we do first? Respiratory system. What's going on? Okay. To adequately determine whether the child is getting enough oxygen. We know whooping cough has to do with the respiratory system. That's gas exchange. We want to make sure that this client is getting enough oxygen, ensuring that, check it off, that the gas exchange is not a problem for this patient. How do we do that? We count those respirations, we measure that oxygen saturation. So that would be number 3. So that's why I say we have to go back to what body system mostly has to do with this. What is that body system supposed to be doing for us? Which organs? So respiratory system, gas exchange, lungs, inflate, deflate. This person has the whooping cough. How do we ensure that that gas exchange is doing as it should be? Counting respirations, looking at that oxygen saturation. Okay. Okay, so why did we not select client number 1?
Because it's an admission assessment. So it's an initial assessment. So only the RN can perform an initial assessment. So out of our scope of practice.
Okay, so going back to the question is asking what can be assigned to the LPN. Good. So why did we not select client number B and client D, B and D?
B's new onset chest pain. So they're unstable.
Okay.
And D got discharge teaching, so only the RN can do that.
And they newly diagnosed with heart failure.
Okay. So yes. So again, know why the incorrect answer is incorrect. That helps because it doesn't matches our scope of practice. It doesn't match something that we can do. So know why the correct answer is the correct answer. Because sometimes you may get hung up on which one is correct. So do it the opposite way. Well, I know this is not correct because of this. It's out of my scope of practice. I know this is not correct because this is new onset. This client is not stable. Great. Good test taking tips. Here we go. The LPN is assigned 4 clients and is supervising an unlicensed personnel. Which task is most appropriate for the LPN to delegate to the UAP? Would we select answer choice D? Would we even consider D?
No.
Exactly. Some answer choices you like, I know this is not correct. You know what you know. So don't try, if it doesn't match what you know, don't try to make it match. We know that the UAP, this question is about delegating to UAP. So these are things that a UAP can do. 5 rights of delegation. We know that a UAP is not going to be administering medications. So we can automatically just don't even look at that answer choice anymore. Go ahead.
So how come A is not a possibility?
Perform blood glucose monitor for a client with diabetes. That one is iffy depending on the setting. Some settings, UAPs don't do finger sticks.
Because that's where I get hung up. Like when I took my Hesi, like that's where I got hung up on. Because there's questions like this, and then like to me, I would have picked A instead of B.
So, but because we know that glucose monitoring, that's one of those things that, depending on even in some school settings, you're that school nurse, if y'all rotated through there, there's some things that you're like, wow, I didn't realize a person that was non-nurse could do these things. But those are the variations. So those tasks that are variations based on the setting, we automatically would not select that one. But comparing assisting a stable client recovering from pneumonia with a bed bath versus performing blood glucose monitoring, which one do we outright know that the UAP can do?
So basically, kind of look at them and see which one's safer.
Exactly.
Which one sounds safer for them to do. So like the stable patient with a bed bath sounds way safer than monitoring that glucose.
As a performing that glucose monitoring, because that varies depending on the setting that you're in. Now, measuring a blood pressure, that would be different. No matter what setting you're in, that's UAP can take blood pressure. But that finger stick, because it's invasive, you're poking someone, you're piercing that skin, that is a thing that they go back and forth with in different settings. So yes, it is safer. We know that this client is stable, they're recovering from pneumonia, and it's a bed bath. Yes. All right. So answer choices, you are that drag and drop. Look at the answer choice independently. Each choice independently. Turn the question into, is this true or false, correct or incorrect? Okay. If it's not a multiple choice, let me go back. Let's look at this slide here. If it's not a multiple choice question, there may be several correct answers. Don't focus on the number of answers choices you selected as long as you select at least one, unless the question tells you to select a specific number. Like that question early on we had, it did not say select 5. You look at each answer choice individually. Does this match? Does this not match? Is this true or false, correct or incorrect? Whichever verbiage that you like. But if it doesn't say select a specific number, then you just read each answer choice independently. And like, oh my, sometimes it's all of them. If it matches, if it fits, then they fit. But don't make it fit. Don't change what you know about a concept. Okay. The LPN is supervising a UAP while caring for several clients on a medical surgical unit. Which tasks are appropriate for the LPN to delegate to the UAP? So again, we have an LPN delegating to a UAP. We're on a med surgical unit. Select all that apply. It's not telling us a specific number. Okay, so let's do this one together. Assist a stable client with bathing. Will we select that? Is it appropriate? Does it match? Is it correct for a UAP to do? Assist a stable client with bathing.
Yes.
Measure and record intake and output. Is it safe? Is it true that a UAP can do this? So we're looking at each question. We're modeling what we just said to do, okay? So assess a client complaining of chest pain. Can a UAP assess a client with chest pain?
No.
Okay. Can a UAP ambulate a stable post-op client for the second time that day?
Yes.
Can a UAP reinforce teaching about wound care?
No.
Can a UAP obtain routine vital signs on a stable client?
Yes.
So that we just model how you can pull out what this question is really asking you and then read each one of them independently. Okay. We know they can't reinforce, and we know that they're not going to be assessing a client for that's complaining of chest pain. All right. So we saved our last 15 minutes toward the end, so we officially call it end time. This recording will be uploaded and shared with all of the we're sharing the Hesi reviews with, because this consists of your Hesi review, so we're sharing with all of the sections. So Dr. Mary will get this, as well as Dr. Collins, and so forth and so forth. Make sure you place your name, campus, and professor's name in the chat if you don't already belong to this class. Take care. We'll see you during week 12.